Hi, this is Nadine the Gluten Free RN. Welcome to episode 5, where we're going to continue talking about gluten intolerance and celiac disease, basically an introduction to what they are and why you should care about them. My name is Nadine Gruskoyak. I'm a registered nurse, BSN CEN. And basically what that means is that I am a nurse and I have a certification for the last 25 years in emergency nursing. I also have experience as a trauma nurse and in critical care. So that is the experience I bring to talking about gluten intolerance and celiac disease, on top of knowing that I've had celiac disease for the last 10 years. However, I've actually probably have had celiac disease since I was a child or even in utero, which means before I was born. But I didn't know that until I was 40 years old and almost dead. So obviously, I'd like people to know a little bit about this so they don't have to go through the same thing essentially that I did. So what is gluten intolerance and celiac disease? What we're going to do is review a little bit of what we talked about on the last episode, episode 4, if you missed it. So celiac disease is actually a genetic disorder, and according to the current definition, you must be a gene carrier of HLA-DQ2 and or DQ8 genes, HLA being the human leukocyte antigen. So there's a genetic component to celiac disease. And you must have documented villus atrophy. Celiac disease is chronic. It never goes away. So it requires a lifelong 100% or gluten zero, as Dr. Rodney Ford says, of 100% gluten zero, lifelong gluten-free diet. It is an autoimmune component, which means your body attacks itself. It is digestive, however, it is primarily neurological, and we'll talk more about the symptoms today, especially the neurological components of celiac disease. It leads to malabsorption of all your nutrients and vitamins from the food that you're eating because you can't absorb them due to the damage to your intestines, which none of us can actually see our intestines. Makes it very hard to actually tell if there's damage until things go very wrong sometimes. And an easy way to maybe test is if your vitamin D level is low. It's one indicator. It's another one of those pieces of the puzzle. If you're taking vitamin D but not absorbing it, or if you're taking iron supplements and you're not absorbing them, there might be a reason for that, meaning that the damage to your small intestines actually is occurring at the area where in your small intestines where those would be absorbed. And once you have a leaky gut or increased permeability of your intestinal wall, and those gluten proteins are capable of getting into your bloodstream, which they do, then every organ in your body can be affected. Because you don't just have a leaky gut at that point, you have a leaky blood-brain barrier, leaky lung tissue, leaky skin, and anything that has epithelial tissue on it. So it is a multi-system issue. And I myself wish I would have known much sooner in my life that I actually had an issue with gluten, because I ate a lot of it, certainly. And I just didn't know that that was what was causing my, somewhat chronic but low-lying symptoms until the age of 36 when I got pneumonia, and then my health plummeted. I ended up with multi-system organ failure. That's never a good idea. So we talked the last episode, in episode 4, about the intestines actually being 70 to 90% of your immune system. And it's extremely important that your intestines are healthy so that your immune system can be healthy. And we also talked about gluten intolerance or non-celiac gluten sensitivity, NCGS, being a lot of the same symptoms, but without the genetic component. And what I find is that a lot of my people that actually are not gene carriers, they do not carry the HLA-DQ2 genes associated with celiac disease, but they're much sicker than my people that actually have celiac disease. So I think the definition of celiac disease over the next several years and incorporating the non-celiac gluten sensitivity is going to change, because I think we're going to find that there's a lot of overlap, or we've misinterpreted a lot of the information. Gluten grains are wheat, barley, rye, all of the subfamilies of wheat, including spelt, seitan, seminola, couscous, durum, kamut, bulgur, farina, emmer, and gram. There's many more names for wheat and subfamilies and different varieties of wheat. You have to avoid them all. They all contain the same proteins, the gluten proteins, and it really doesn't matter if they're sprouted or soaked or how you might want to process them. Even in a sourdough, those proteins are still there. They might be fractionated or broken up a little bit, but they're still damaging. And then I also include oats because of the cross-contamination issue. So it's the fields they're grown in, the silos they're stored in, the trains they're transported in, and then, of course, the facilities they are processed in. So there are 6 to 7 companies between the United States and Canada that actually have certified gluten-free oats. And one of my favorite is from Gluten Free Montana. They actually have a website, www.glutenfreemontana.com, and you can get gluten-free oats from them via mail order. And actually, I think they're the highest quality oats I've ever had, period. So if you're still interested in oats, I would go with them. It is highly recommended that if you are newly diagnosed with celiac disease, that you do not eat oats at least for the first year, giving your intestines time to heal. And after that year, we do recommend that people try extremely small amounts of oats on a very occasional basis to see if your intestines can handle that. Some of us still cannot eat oats even after, 10 years of being on a gluten-free diet. The good news is there's lots of gluten-free grains and flours to choose from. It's best to choose whole grain. So if you're going to eat grains, I do recommend teff and quinoa primarily, mostly because they're the most nutrient-dense grains, but there's other grains to choose from: millet, buckwheat, amaranth, corn, sorghum. Because I'm on a variation of a paleo diet, I stick mostly with the nut flours, which would be chestnut, almond flour, coconut flour, hazelnut flour, pecan flour. So you can see there's lots of different options, and you can get pretty darn creative with a lot of these gluten-free grains or paleo flours. We live in America, so gluten hides everywhere. Lipsticks, personal care products, Play-Doh, prescription medications, and vitamins. But there's lots of food to eat. Fresh fruits and vegetables, meats and fish. Hopefully it's organic, 100% grass-fed. But we do the best we can with what we have available because not everybody in the country lives in the Pacific Northwest. That would be odd. But we have basically what I consider to be a food utopia in the Pacific Northwest, where we have a vast quantity and of great food year-round, and a lot of local farmers that are producing 100% grass-fed, no antibiotic, no hormone, beef, lamb, chicken, all kinds of things. It's great. So we eat extremely well here in the Pacific Northwest, and I hope where you live, you can eat well too. A lot of it is just choosing the things that are the most nutrient-dense and that are going to help your body heal. Rice, corn, and potatoes are the 3 main starches. If you are going to eat them, I highly recommend that you eat rice that is like a brown rice or some color to it. Anything with color is going to be a little bit more nutrient dense than anything that's white. So sweet potatoes and yams over white potatoes for a number of reasons. Not only are sweet potatoes and yams more nutritious, better color, a lot better fiber, but they're also not nightshades. White potatoes are a nightshade. And for people with neurological issues such as migraine headaches, sometimes the nightshade family of food products can actually give people migraine headaches or have been noted to be a trigger. So anything from the safe grain category. Dairy products are okay, but because those proteins are molecularly very similar, we do recommend that people are very careful about adding dairy products back in. And the nice thing is that there's many, many, many more non-dairy products that are available, such as Kite Hill, which is a non-dairy cheese made from almond milk. That is one of our favorite cheeses overall. And they also make a nice yogurt product that, again, is almond milk. There are more and more products that are certified gluten-free, which means that they are less than 10 parts per million. So they're tested to have less than 10 parts per million of gluten in them. That's a very tiny, minuscule amount, but some of my people still actually react to a very minimal amount of gluten. Please keep in mind that gluten is a toxin for people with gluten intolerance and or celiac disease. Where we left off last episode is with symptoms and complications. So let's just say your body is chronically inflamed, and that's any itis. Any itis means gastritis, plantar fasciitis, bursitis, arthritis. That itis means inflammation. So if you're always taking some industrial-sized bottle of Advil or Tylenol or anti-inflammatory, non-steroidal anti-inflammatory for pain, there's a good reason that you should actually find out what is causing that inflammation in the first place, because inflammation does not happen in a bubble. And a lot of times that inflammation can move around our bodies. So we really want to get to the core issue of what is causing that inflammation. And what we're finding a lot is that our people with gluten intolerance or celiac disease have had a lot of inflammation in the past. They go gluten-free, and a lot of that inflammation just completely goes away. And then if you add on it that celiac disease is an autoimmune issue, so your body's attacking itself, that is never a good idea. I just don't recommend that your body is attacking itself. And you have a damaged immune system, because if your intestines are damaged, your immune system is damaged with either a Marsh 2, 3, 4 damage, and that damage can be patchy. So if your intestines are damaged, so is your immune system, which means you may or may not be getting every cold that comes around, and it takes you much longer to recover. And then the malnutrition and deficiencies. If you add those 4 components up of chronic inflammation, autoimmune, damaged immune system, and malnutrition and deficiencies, because your intestines are damaged overall, then you are at increased risk for things like lymphoma or bowel cancer. And that is pretty much what the docs tell you, is that people with undiagnosed celiac disease are at risk for those 2 types of cancer. And that very well may be true, but the reality is I see people in my office quite a bit with things like brain cancer, bowel cancer, neck cancer, salivary cancer, liver cancer, stomach cancer, kidney cancer, and that's really just the tip of the iceberg. Prostate cancer. It goes on and on. So a lot of my people have a history of cancer. So we have to take into account that if they're undiagnosed celiac, there's a good chance that a lot of these components all together put them at risk for developing either lymphoma, bowel cancers. Those are kind of bad enough. Or some of the other cancers we talked about. And really, those are the cancers that people show up in my office with a history of. And usually they get diagnosed with those cancers before they find out they have celiac disease. If a doctor is going to look for celiac disease, they typically look for 2 things: chronic diarrhea and malabsorption. Sometimes they factor in the extreme weight loss and malnutrition. But unless those components are there, very rarely is a doctor triggered to test for celiac disease proper. And to test for celiac disease proper, according to the current medical standard, it would be a positive blood test. So they would do a celiac panel. And if that test was positive, they would then refer to a GI specialist to get a biopsy of the small intestines. There are problems with both those tests, and it makes them difficult to actually be accurate. If you get a positive test, fabulous. You are in the celiac club. You have positive, definitive information. And if you have a positive blood test that includes a positive anti-tissue transglutaminase and a positive anti-endomyocele antibody, which is the positive anti-EMA, you'll see that. Then the University of Chicago has said if those 2 components of your celiac panel are positive, then you have damage somewhere whether the doctors can find it or not. So those positive biopsies are sometimes hard to come by for a number of reasons. One, it's been determined multiple times that most of the gastroenterologists are not taking enough samples, biopsy samples in the small intestines from various areas because the damage can be patchy frequently, or, I hope it's not frequently, but it has been noted that the damage can be missed on biopsies. And the current standard per the AGA is to take between 6 and 15 samples during the endoscopy of various regions of the duodenum and, if possible, the jejunum. What I like best is a clinical trial, which means that symptoms resolve on a gluten-free diet. So whether your test comes back positive or negative, but you're still having symptoms and you'd like to get to the bottom of what's maybe, causing you a lot of symptoms and pain and suffering, then going on a gluten-free diet after you've been tested, whether it's positive or negative, you can go on a gluten-free diet. You have that option. And if you go on a gluten-free diet, I highly recommend it's at least for 6 months. And the reason for that is because it does take 6 to 12 months for your small intestinal villi to actually regenerate in the absence of gluten. So you have to remove the gluten before your intestines will regenerate. And that process takes 6 to 12 months, depending on how much damage is done. And for some of us, that regeneration of our intestines can take a little bit longer. And some people really don't feel better until after a year. They don't notice that they feel better until they've been on a strict gluten-free diet for over a year. So everybody's different. There's lots of variations on how long it takes people to feel better. Some people feel better in a day, which I think is miraculous in the absence of gluten. But for most people, it takes a little bit longer. They might significantly feel better. But then for the long-lasting changes to occur and the pain to go away, whether it's in your intestines or in your joints, it can take a little longer. So that's basically what the doctors would be looking for the most part, or what they were taught in medical school, that it's chronic diarrhea, malabsorption, extreme weight loss, and malnutrition. Those are things that the docs might be triggered to test for celiac disease. But I look for the 300 plus other signs and symptoms associated with celiac disease. I look for the symptoms outside of the GI tract, but primarily the neurological symptoms. Because at least 50% of the people that have celiac disease complain of some neurological disorder or symptom. Neurological symptoms being migraine headaches, seizure disorders, neuropathies, that numbness and tingling you get in your hands and feet sometimes, or sometimes it's in funky patches on your body. It could be on your face or your thighs, different areas that would seem to be a little bit odd for getting numbness and tingling. So seizure disorders, difficulty walking. There's one very interesting component of celiac disease, and it's celiac cerebellar ataxia. So the back of your brain is where your balance is controlled from, so your vision helps, but your proprioception, which means where your body is in space and in your environment, is all regulated by your vision and then what we call proprioception. But there's very well documented connection with celiac disease and this area in your cerebellar region of your brain getting affected by the gluten. And we already talked about a leaky blood-brain barrier, so that those proteins are capable of actually crossing the blood-brain barrier and causing damage to your brain. Not a good idea. We'll come back to the neurological component of celiac disease in another episode, but for right now, please know that one of the main regions of your body that is affected by gluten is neurologic. So anywhere in your neurologic system, so that's your brain, any of your nerves, can be affected by gluten. And sometimes primarily and sometimes exclusively. Some people don't even have any GI symptoms or gastrointestinal symptoms. They strictly have neurologic symptoms. Cardiac issues, that can be anything from arrhythmias such as AFib, aflutter, especially if there's a deficiency in calcium and or magnesium or an imbalance of either one of those. So again, if you're not absorbing your calcium or your magnesium appropriately, even if you're consuming them, it can affect your heart. And there is also a lot of research on cardiomyopathy. Cardiomyopathy is caused by gluten, which is an enlargement of the heart. And normally what we do with cardiomyopathy is we wait until it gets bad enough and then we give people a heart transplant. But here, in this case, if it is caused by gluten and you remove the gluten, people don't have cardiomyopathy anymore. So heart transplant or diet change. Some of us have some big questions to answer about, what is most important. Do they really want to go through an open heart surgery and wait for somebody else to die to get into somebody else's heart? Or do they want to try a gluten-free diet? I'm pretty sure I know what one I would choose if I was put in that position. Respiratory issues, chronic cough, difficulty swallowing, again, neurologic, asthma, lots of different respiratory symptoms. Those people that always clear their throat, they always feel like they have phlegm in their throat. We found a lot of people actually have that cleared up once they go on a gluten-free, dairy-free diet. Dermatologic, that's any skin rash, by the way. I could not self-diagnose my DH or dermatitis herpetiformis, the rash that goes along with celiac disease, because it's misrepresented in every derm book I've ever read. And I've read most of them. Since I was in the emergency department and had access to lots of medical journals and textbooks and all kinds of things going back years, I read them. And so I'm really good with some of the dermatologic issues. But what I found is that DH or dermatitis herpetiformis can actually look like different rashes on different people. And it can look like different rashes on different areas of your body. It's fascinating. But your skin is an external expression of whatever's going on internally. So if your skin looks bad, some of your organs probably look bad too, starting with your intestines. Try to keep that in mind. Urinary issues, that's anything from kidney stones, repeat urinary tract infections, difficulty urinating, incontinence, prostate cancer, prostatitis. So anything in the urinary system. Keep in mind that our bodies are all in one big bag of skin, and everything is connected. You cannot separate things out. So behavioral, anybody that's mean, nasty, irritable, cranky should be tested for celiac disease. And during my classes, I frequently recommend that people, suggest to their neighbors or their people that they work with that are kind of grumpy that they get tested for celiac disease. And then please let me know how that works out. Because the reality is that if people's brains are affected by gluten, then they have a hard time acting rationally. So I do an 8-hour lecture just on the mental health component of celiac disease because it's enormous. So we really do want to make sure that people's mental health is actually attended to. And if that includes testing for celiac disease, then please, by all means, find a doctor that will do that. Anybody that actually has osteoporosis, osteomalacia, osteoarthritis, is short or has frequent broken bones or broken bones that don't make any sense should be tested for celiac disease. And again, any psychiatric disorder. Because there's roughly about 60% of the people would say that they have no issue eating gluten. That would have been me. I would have said, I don't have any symptoms. Why would I get tested for celiac disease? And plus, I love my bread. I'm a carbaholic. What else would I eat? That's all I've ever eaten. It doesn't make any sense. That's all. We've always eaten weed. It's so good for us. I even got those jars of wheat germ and put it in my smoothies and things before I knew about this because I was so constipated. And I thought, wow, more fiber. Constipation is not a lack of fiber and water. It's actually a neurological issue for the most part. But celiac disease can be silent, which means that you don't have any symptoms, or if you've always felt like that and your body has just compensated and you've just compensated around your symptoms, then you would say, I'm perfectly fine. There's nothing wrong with me. But once you go gluten-free, you realize that you feel enormously better. And a lot of those symptoms that you didn't recognize as symptoms go away. So I do recommend that everybody get tested for celiac disease, at least for a baseline. If the test comes back positive, great. But if it doesn't mean a thing. Because you can seroconvert, which means you can come back with a positive blood test 4, 6 months, 12 months after that initial blood test is positive. So just because the initial one doesn't come back positive doesn't mean a thing. You can seroconvert at any time, at any age, especially if you're a HLA-DQ2 and or DQ8 gene carrier. Some of my top list of symptoms: chronic anemia and fatigue, muscle and joint pain, depression and irritability, any thyroid disorder. For some reason, that thyroid gland has a bullseye on it for those gluten proteins. And a lot of my people actually have some type of thyroid disorder. A lot of thyroid disorders resolve on a gluten-free diet, provided the thyroid is not taken out or ablated. Once that happens, you just have to take your thyroid replacement medications. But I've seen amazing things resolve on a gluten-free diet, especially with the thyroid. I had Graves' disease. I do not have it anymore. Infertility. If you're a man or a woman and you have infertility issues and you live in Finland, the number one thing they will test you for is celiac disease, because it has that big of an issue. Gluten has that much of an impact on the reproductive glands and organs. Down syndrome, Turner syndrome, and Williams syndrome. Any GI issue, again, from your mouth to your rectum, so dentists should be looking for celiac disease. Seizures, skin rashes, psychiatric disorders, migraines, and then any associated autoimmune diseases. Once you have one autoimmune disease, your chance of developing another one is 30 to 50% greater. So what we're finding is that almost every type 1 diabetic is an HLA-DQ2 or DQ8 gene carrier. We'll come back to that when we talk specifically and exclusively about insulin-dependent diabetes. Lupus, Sjogren's, hepatitis, thyroiditis, Graves' disease, Addison's disease, arthritis, sarcoidosis, and there's a whole list of autoimmune diseases. I highly recommend that people collect things like Beanie Babies or beach rocks or beach glass as opposed to collecting autoimmune issues. If we are looking for celiac disease in children, specifically failure to thrive, short stature, these kids are falling off the growth chart, and they're not actually as tall as their peers. They're not developing appropriately. They have diarrhea and or constipation. Learning disabilities such as ADD, ADHD, ODD, which is oppositional defiance disorder, autism, skin disorders such as eczema or psoriasis or acne, delayed puberty, dental problems, anorexia or obesity, and bedwetting. Celiac disease in elders shows up in urinary problems, dementia, Alzheimer's, cancers, ataxia. Remember, that's the hard time walking straight. You might walk like you're drunk and have balance issues, arthritis, hair loss, fatigue, osteoporosis, and vision and hearing loss. Normally, we should not assume that all these things fall apart as we get older. We should really be maintaining our brain structure. Our brain should not be shrinking, and our body should remain very vital until we get to a very old age. And that's just not happening anymore. Well, that's it for episode 5 and the second part of what is gluten intolerance and celiac disease. This is Nadine Gruskoyak, the Gluten Free RN, located conveniently in downtown Corvallis under the Dark Side Cinema. It's the only office like it in the world, and it's a community resource for people with questions about gluten intolerance and celiac disease. We have books and educational material and are a local resource. However, if you are ever in Corvallis or visiting Oregon, please make a special attempt to come down and see what we have available. You can also call me to set up an appointment for a consultation or contact me at nadine@glutenfreern.com. We also have social media presence on Instagram and Facebook. And now, very proudly, we are producing the Gluten Free RN podcast. It's very important that people get this information, and anything I can do to help move that along and get people educated. As a nurse, I feel compelled to make sure that at least I'm doing my part, because this is a public health crisis that is not being very well dealt with, and somebody needs to deal with it. So here we go, wrapping up episode 5, and I can't wait for episode 6. So see you for the next episode. And for right now, signing off, Nadine Gruskowiak, the Gluten Free RN.